Hello, everyone, and welcome to the next in our series of SMI University programs. I'm Nancy Anderson, Associate Executive Director of SMI. We're very pleased to have you with us today. And with us, joining us for the presentation and the conversation are Susan Lewis, the Vice President of Healthcare and Strategic Accounts with Staples, and Jim Francis, who's the Division Chair and Chief Supply Chain Officer of Supply Chain Management for Mayo Clinic. Jim and Susan are going to share insight today on what contributed to their career success, the key tipping points, the successes, failures, their key learnings along the way. They have some interesting and very different perspectives to share, and I hope you each take away some great thoughts and ideas from today's discussion. A quick comment on logistics. We're going to be taking your questions during today's conversation. We've got all participants on audio only, listen only mode, but we will take questions and share them with Susan and Jim as the conversation goes along. This is going to be a very informal exchange and conversation, so we welcome your questions as we go along. And you can just submit those through the app, the GoToWebinar app, in the questions module. So Christine will listen for those. She's listening in the background, and she'll watch for those questions and share them with us as we go along. So please feel free to share those questions and just add your thoughts to the discussion. We're looking forward to having a great interactive conversation today. Welcome, Susan and Jim. Thank you very much for being with us. And I wanted to start the discussion today by having each of you tell us kind of your career story. How did it get started? What were the key points when you feel like things really picked up, or something that made a transition happen for you? What are the key steps that led you to where you are now, and kind of those key factors that you feel like contributed to your success? So Jim, I'm going to start with you and let you just kind of give us a brief overview of your background and your career and how you got to where you are today.
Sure. Thanks, Nancy, and hello, everyone. It's a pleasure to be with you. It's also a pleasure to share a panel with Susan Lewis, that I've known for many, many years and really respect as a leader in the industry, and has been a key partner with ours here at Mayo Clinic for many years. I think if you know me, I rarely talk about myself. I'd much rather talk about the supply chain team at Mayo Clinic and the success that they achieve as a group. So this is a little outside my comfort zone, but I'll do my best. What I would tell you is that I think I knew from a very early age that I wanted to go in healthcare. To that end, when I went into college, I met the realities of something like chemistry and physics, and knew that I had to readjust my thinking in terms of where I wanted to focus in healthcare. So I made a shift in my college years to focus more on the business side of healthcare. Went to and graduated from Washington University, the Health Administration program. And I graduated with my MHA in 1994. I went to work right out of college to an organization called Christian Hospital Northeast and Northwest, which was in North St. Louis County. It was a great educational opportunity for me as a graduate because the organization was a health system of hospitals at the time, and also had a lot of diversified activities, so I could, dip my toes into other areas of interest that I had as I grew. I worked there for about 9 years, and had a variety of responsibilities, including supply chain management as a department was responsible for. We merged with Barnes and Jewish Hospital in 1999, and we became the C in BJC Healthcare at that time. And there was a period of time I went through, I wasn't sure exactly what I was going to do in the newly merged entity, but they asked me to run the supply chain, and I took on that responsibility and ran it for 6 years to 1999 when I was recruited to Mayo Clinic to run the supply chain. I've been at Mayo ever since 1999. So I'm on my 21st year and have a total of 36 years in healthcare since graduating. So that's kind of my story and how I ended up here. I know it's a little different for everybody. There's a variety of ways that people advance in their career nowadays. I've really only worked for 2 organizations, and that's a little bit unusual. Many times people work for multiple organizations. There's nothing wrong with that. It's just how you advance in your career that dictates whether or not you work for multiple or fewer organizations throughout it. So I'll turn it over to Susan.
Thanks, Jim, and thanks for this opportunity. My career was a lot different than Jim's. I came out of college, University of Florida, went to work for a family business, and had an invitation to attend a Material Management Association of Florida meeting. And we were a local vendor, family business, and the materials manager said, hey, can you bring some stress balls or something to give out? So I did. I met a whole lot of people in the healthcare business, and it was never a specialty area for me at all. But I did have a guy who ran a hospital who came over to me and said, hey, I'm going to be doing a bid for 4 hospitals in Southwest Florida. Would you like to come see me? And I said, yeah, I'd love to. So that began my healthcare career. So we went from 4 hospitals to 7 to a contract for the state of Florida for all the hospitals for HCA way back when, and then into a national agreement. And so that's when I really focused on healthcare. I was the entire healthcare team 20 years ago. And then over the years, we've been able to grow that portfolio, nationwide across all the large GPOs and health systems in the United States. So it's just, I have a nice team of people, awesome team, and a lot of business now. And it all came out of going to a Materials Management Association meeting and getting to know people. So that's really, Nancy, I'll try not to take up too much time going into all the details. That's a thumbnail of how it all began.
That's perfect. And I think it's a great story of how a moment in time can make such a difference to someone's career on the one hand, and then Jim, a really planful approach to wanting to be in an industry and having it really play out the way it has. And both are examples of how we can each build career success differently and not miss out on those opportunities that might kind of shift the direction that we are thinking we want to go. So thank you. In addition to talking about kind of just general career success, could each of you talk about, and Susan, I'll let you start first, how you've balanced over the years career and family? How have you made that balance work or not work, as the case may be?
That's a challenge. I think that's something that you really have to work hard at, because the business, especially when it's growing, will take every bit of you that you're willing to give it and then some. So, that's probably the biggest piece of advice I give people coming in now is carve out time, or you won't have it. And I mean, Jim's nodding his head, and I'm laughing to myself, because it's not an 8 to 5 job, and probably most of the people listening on this call know that. It's 7 days a week, and it's whatever comes up whenever it comes up. And I think that being available and that your customers knowing that you're available also, sends a strong statement. And the balance part is a challenge. And I think you really have to work at building that in to your time. Jim? Oops.
I think, there we go. You were on mute.
There you go.
I think you're off, Jim. Oh, Christine, can you take Jim off mute? Still on mute.
Okay. It looks like, yeah, very good. I certainly can relate to Susan. We all have something called a phone now, a mobile phone, that keeps us connected to our jobs 24/7. And a lot's changed over the industry over the years I've been involved in it. And I can still remember my hardwire installed mobile phone in my car, the first one that I got when I was working for BJC. And boy, things have changed dramatically since then. So we're connected. It doesn't matter where you're at. but work-life balance is hard. And I think Susan's advice is spot on. You have to plan for it. And I'm talking about actually physically scheduling time for work-life balance. If not, you'll give 150% to the job. And unfortunately, things suffer as a result when you don't make time for it. So when my daughter was growing up and she wanted to play tennis, I scheduled when I needed to be out of the office so I could watch her play tennis. And I feel like I didn't miss the important things in her life as part of that too. Work's always going to be there. And when you're in a leadership role, the expectations of you and what you do is fairly dramatic. And like I say, we're all tethered right now. I will say that, we're all experiencing this new virtual environment that we're working in. We are hearing from our staff that they feel like they have more work-life balance as a result of working from home, which is great news. But preserving that, because as we even know today with little experience in it, our lives can be dominated by Zoom calls and other activities that we've now added to the equation of staying in connectivity with one another. So it's something that we have to take seriously and plan for.
Jim and I, Nancy, have a story we shared that happened on over a weekend. And Jim, is it okay to share this one? Okay. So I get a call from Jim and he says, hey, we really need your help. We had some exams that some of our docs took, and someone took them down to our receiving area to be sent back to the testing company, and they got put on a pallet of toner cartridges that were being picked up to be recycled. And so we have it's in a FedEx labeled box, and it's on top of the pallet that you guys picked up. And you got to find them, or else I won't even be here next week if I have to tell all these doctors that they have to retake this exam. So, and Jim's like, here's my cell phone, call me anytime, it doesn't matter. And so I call our supply chain guys, and they're all excited to be able to help out Mayo Clinic. And we track it down. It was on a truck on its way to Mexico to be recycled. All these boxes. So they get the trailer pulled over. They go on, they pull off all the pallets. They find the Mayo box. They call me, and I called Jim on a Saturday morning, and I was so excited that we had it. And I'm like, oh, get it up. And he's like, here's our FedEx number or UPS number, whatever it was. And I said, don't worry, we'll get it back to you and all that. And he's like, what can I do? Can I write a letter? Can I do anything? And I said, yeah, an email for our supply chain guys would be great, because they're so excited that they got to do something and help Mayo out on something like this. And that's all it would take. So that one turned out well. And we've had our share over the years. But that was a good one.
It's the little things that make all the difference in a relationship between providers and suppliers.
Yeah, absolutely.
Definitely. Thanks for sharing that story, Susan. I love that one. And speaking of that, talking about team leadership, because Susan, it's obvious that was sort of a good example of bringing your team together on all different levels and making something happen for the customer. I'm going to ask each of you, but starting with you, Susan, what is your key strategy for team leadership? How have you, over the years, built effective teams and relationships with your teams, and kind of how did you build that culture of partnership that obviously produced the outcome with Jim and his exam crisis?
To me, it's all about relationship selling, and whether that is with the people on my team or with the customer, it's all about building trust between people so that we all work, together for the common good. And I think that building a relationship where I have people on my team that I really care about, and I know they care about me, we care about the company, we care about the customer first. And so that's really our priority. Very, very little turnover at all. I have a very seasoned team, and we like what we do. Even our support team, they have virtual happy hours once a month, just different ways of sharing with each other. And they're really committed to each other. I love it. We help each other out all the time, and it doesn't matter whether it's something business or something personal. So I think that supportive team culture is absolutely key. And when people know you care about them, they really, we all work together so much better. And I don't care whether that's somebody on my team or Jim or any other customer out there. When they know that they have somebody that really is looking out for their best interest, I think it just fosters a very, very collaborative environment. And everybody wins as a result of that.
And your thoughts on Susan's comments or other thoughts about team leadership and how you get your team to really come together?
Sure. One thing I didn't say in my career story is the fact that all of my education in supply chain management came from on-the-job experience. Today, there are many programs that offers masters in supply chain management degrees or concentrations for an MBA and so forth in supply chain management. That was not my experience. I learned on the job and from the people I interacted with over the years. And I know my staff is quietly saying, we know that. So, but I would tell you that I'm blessed to have a great team. I believe firmly in hiring the best and brightest you can find. We've had very little turnover in our leadership team in the years that I've been here. To me, the most critical element, and Susan touched on this a little bit, is making sure that the values that people bring to the team are aligned with yours to some degree, and also aligned with the organization's. The ability to work together as a team, to collaborate with one another, to respect one another, have high integrity is critical to the success of what you've got to get accomplished. I think also if you involve them firsthand and related to developing the vision for what you want to get accomplished so that they have buy-in to it, helps align the team dramatically also. We work hard, we play on occasion, but we're also focused on doing the very best we can for the organization and committed to continuous learning and advancing the performance too. And I think that's all part of what contributes to the success of a really good team and what you can get accomplished for your organization.
I agree completely.
Excellent. Well, I know you both have excellent teams, and the tenure of your teams is great testament to the kind of culture that you've put together. So congratulations for that. Jim, shifting a little bit to supply chain itself and talking about, you have been in this industry, as Susan has, for quite a long time. And I think you just made a reference to the fact that, as you and I both experienced, there was no supply chain educational channel for us when we came into this industry. Would love to have you talk for just a few minutes. This will be the FedEx version of the evolution of supply chain through your career, how you've seen things change over time, and sort of the perception of supply chain, which is elevated more than ever these days. But would love to hear your sort of sense of how things have evolved over the course of the time that you've been in the industry.
Yeah. Well, the only thing that's been constant has been change, and there's a lot of things that people, I think, would consider tipping points, and we've been working through one for the past several months and continue to do so. I mean, no one envisioned a worldwide pandemic, and that pandemic has taught us many, many lessons about the supply chain and what's worked well and what's not worked well. And that certainly is one of those tipping points that I think has driven the supply chain to do things differently, and will for the next several years probably. Over a course of a career that's been 30 some odd years, I've seen my share of tipping points. Most of them have been driven by the economics of healthcare. When I came out of college, it was the introduction of DRGs, diagnosis related groups, and people had trouble with the concept that, we were going to have to get a fixed payment associated with a person's stay. And that was going to drive, what we needed to do in many, many areas, but certainly in supply chain. So the strategic importance of supply chain, starting back many, many years ago, where it was basically a procurement function. Somebody needed something, you bought it, to what it is today, a strategic advantage for many organizations has been shaped by all these tipping points. And from DRGs to managed care to the Affordable Care Act, and there are other factors too. I talked about the pandemic. All of those things have resulted in the elevation of supply chain, not only as a career, but also in the organization that you work for and the importance of it and what you can contribute. The bottom line is, and always has been, if care providers don't get supplies, they're not taking care of anybody. So supply chain is critically important. I tell everybody, it's like, if you don't think you're important to the bank, miss a mortgage payment. If you don't think you're important to healthcare, stop delivering supplies to a location. You'll find out how important you are. So there's been a lot of change, and it just continues to grow. I mean, there's new disciplines every year that we're learning about that we have to now because it's an importance to supply chain management. A current example is third-party risk management. Critically important to understanding the parties that you do business with, and will be for the foreseeable future.
And Jim, follow-up question, I shouldn't say do you, because I'm sure you do. How do you think the evolution has changed the kind of people you look for to hire and the kind of people you are able to hire?
Yeah, well, no doubt about it. The skill sets and abilities of people that we recruit today are different from what we recruited years ago. We're in an environment where agility is very, very important. I mean, we made a major shift in our supply chain activities to respond to coronavirus. But certainly the skills and abilities have shifted. Having flexible skill sets, creating the ability to do something more on an agile basis, I think is true today. I'd say in general that leads to more generalists, more so than people with very specific skill sets, but depending upon the areas that people are working in, some specific skill sets are still critical. The other thing that, I guess you could call me old school, some people call me a dinosaur, but the skill of people that we see coming out of college nowadays scares me to death. I mean, these kids are really, really bright. And they understand technology and analytics and data and what you can do with it far greater than I can. And I'm very appreciative of the fact that they're going to help shape the future of supply chain management, because they're providing us with that information that we've always searched for and present it to us now in a format we can understand it. We can also share it with other people and make better decisions. So it's an exciting time to work in supply chain management.
It is. I have a number of younger relatives who are what you described, Jim, super smart and in supply chain and doing really impressive things. So it's exciting. Exciting. Jim, I'd like to ask you one more question and then we'll go back to Susan, but I'd like to ask you what you would define as your biggest career success thus far, and sort of how did you make it happen? And what do you think was the outcome of that success for you personally?
Yeah, well, undoubtedly, it's coming to Mayo Clinic and taking an organization that basically had a decentralized supply chain 20 some odd years ago and building it into one that's systemness, it's one of integration, it's one of consolidation, and taking it to the point where it's nationally recognized. We're doing diversified business services. We're expanding what we do with collaboration. We're doing more partnerships today. just a variety of things. And really, it goes back to the fact that I've had great help over 20 some odd years, and I've had a team that's been focused, working towards a vision for our supply chain and a corresponding roadmap that has taken us there. So without a doubt, it's the 20 years I've been at Mayo Clinic so far.
So far, so there's a lot more to come, huh?
Hope
Well,
so.
I get asked that question quite a bit, so we'll see.
We hope you stay there a good long time. Susan, on the flip side, what's been the biggest failure that you've experienced in your career, and what did you learn from it? How did you kind of turn it into something that you could build on?
The biggest failure was losing my largest account ever. And I was crushed, I was devastated by it. And the customer called me 3 months later and said, "How you doing?" And I said, "I'm doing okay. How are you doing?" And I heard, "I think you know how we're doing." And so anyway, they asked us to come back. And they came back a better customer than they ever were before we lost them. And so I would say that was the biggest failure, but it ended up being a huge success because, like Jim was saying, and I think we're very fortunate to have Jim. Jim is an icon in the industry. He's the Hall of Fame. And one of the strengths that I think is part of Jim and Mayo's culture is sharing. And they collaborate with their partners and their patients and everybody else. And that to me creates a much more a strong and helpful relationship for both the provider and the supplier, because we work things out together. And when things come up, we're able to tackle them versus just filling out a spreadsheet and you end up with whatever you end up with. And so when I hear Jim talk about it, and I think that's also what creates such a positive culture on a team and keeps people engaged and keeps people going towards a vision and going in the same direction, is the level of respect and confidence that they have in the person that is out there working it with them. And so I applaud Mayo. They're one of the very best in the business, and Jim has done a phenomenal job leading them. So for that to be his top success, that's an easy one. That's an easy one for him. And then for me on the loss, that was a huge lesson because I really was devastated, but it ended up working out in the long run all the way around. So if I had any advice, I would just say, don't give up. I actually had a customer who I was calling every day. And I said, "Am I driving you crazy?" And he said, "No, you're not driving me crazy. I'd say you're being professionally persistent." And so if somebody tells me stop calling me, I just say, "No, I'm not trying to bother you. I'm just trying to be professionally persistent." And but being able to have the back and forth and have that, be able to talk to each other, that's absolutely key to building these relationships. And then we both help each other.
Yeah, I remember when you shared that story with me, Susan, and how devastated you were. And my walk away from that was how resilient you were in recognizing that maybe it might work out still for the best and that customer might come back to you. And that's something I learned very early on in my career too. And that's even though there's always a natural tendency to try to burn the bridge or set the bridge on fire. Don't burn bridges. Don't burn bridges. That's something I learned very early on, and in that case, that my own experience, it worked out well. But we work in an industry that's very small. We work in an industry that pretty much everybody knows everybody. And through venues like SMI, we strengthen those relationships.
Yeah.
But I learned that you never know when things are going to come around.
Absolutely. That was a huge lesson for me.
It's a great one to keep in mind during those times when things seem to be pretty dark.
When you hear the customer say to you, you left professionally and you left like you always knew you'd be back, then to me, that's a huge compliment, because you treat them the way that you would want to be treated. And the door's open and they feel comfortable calling you and saying, hey, can we talk? And that's what it's all about.
Definitely, definitely. I think, Christine, we have a few questions from the audience if you want to share them with Jim and Susan.
Yeah, we do. Thanks, Nancy. So the first question is for you, Jim. How is supply chain demonstrating and documenting value for the Mayo Clinic?
Yeah, well, we've talked about the history of supply chain management and how it's changed. And I think all of us can relate to the fact that many years ago, when I described supply chain management basically as procurement, success was deemed as, did you get the product for the physician that wanted? And of course, as the economics of healthcare changed, we've moved on to focusing largely on price. We now know today that value can be defined in many ways. Pricing is just one aspect of it, but is a product safe? Is a product of high quality? Does it produce the outcomes associated with it? Does it result in better patient experience, lower lengths of stay? There's just a wide variety. And while we're still probably stuck in the period of time where we're looking at how much savings did we have, we're now starting to add a lot more different value components than we ever have when we document savings for the organization or improvements for the organization. I think that's going to change. We've got some really exciting work going on at Mayo because when we implemented our new electronic medical record and we expanded our point of use technology, we now track products by UDI all the way from start through to the medical record. We're doing some research now on reliability of products and all those other things that could be part of the value equation that I mentioned earlier. That's, I think, going to provide some really interesting insight. So we've got our fingers crossed to see how some of that work starts to turn out.
Excellent. Thanks, Jim.
Great.
And Christine, other questions?
Yeah, we have a question about how are you shifting to accommodate our new normal with staying connected to your teams, your organization, and your partners? Susan, do you want to take that one?
Sure. Or I'll start. I'm sure Jim's will be more interesting. My team really is spread out, and we've been working virtually for a long time. Now, we interact with all kinds of corporate teams that prior to COVID were at corporate locations, but most of my team was virtual to begin with because we cover the whole country. So I think it's been great. If you already know the people that you're working with, I think everyone has tried to flex and be agile and adapt to being on a Zoom call or a Teams call or whatever. And I think everyone's really trying hard to, make everything work that way. And to Jim's point, I think it's been a huge morale booster and a big win on the employees side for people that were not accustomed to working at home. And even a couple of my customers who said, oh, I never thought I would like it, are telling me it saved them. They got to sleep an hour and a half later. It saved them 2 hours in commute time, and things like that. So I think that the virtual workspace is here to stay. And it's just a question of, is it going to be all the time? Will there still be collaboration in person, which I believe there will be, and I hope there will be, and eventually get back to being able to have in-person meetings. But I don't know that it's ever going to go back to the, or that it's going to be a while before it gets back to the full-time, day in, day out kind of structure that we all, we're used to.
Yeah, one thing I would add to Susan is that I think every organization, based on discussions that we've had with them, and I know SMI has an initiative right now underway about virtual relationship management. This will be something that will become, part of our life. from here on out. Mayo has quite a few work streams that are underway to determine what the final state looks like. You know, we've always had people work remotely in supply chain, and those people will continue. The majority of our staff are home today because of the infectious nature of the coronavirus. And I don't know that a lot of decisions will be decided in terms of final decisions until we get through this infectious stage. So sometime in 2021, when the majority of us probably will be vaccinated and we will have this under more control, the organization will probably make some final decisions about what does the ultimate model look like. And I think there'll be probably a hybrid activity associated with this. But we'll see how that turns out. Certainly here to stay.
Yep, we're hearing that from kind of all over the market these days, and for better or worse. Christine, I think there's another question.
Yeah, we've had a couple questions about domestic manufacturing, and would like to get your thoughts, both of you, on prioritizing made in the USA and also minority-owned businesses post-COVID. Jim, do you want to start with that?
Yeah, well, I don't want to be repetitive to what we all know and what we all experienced through the early months of COVID. And how we've had an over-reliance on overseas manufacturing for a number of years. I think the pendulum has shifted in terms of preferring U.S. or nearshore manufacturing capabilities over Southeast Asia capabilities. I think that's hopefully here to stay. You know, I think we all felt a little betrayed, if you will, by the actions that were taken and maybe are continuing to be taken by overseas manufacturing when we're dealing with a worldwide pandemic. We've shifted some of our most critical needs to US-based manufacturers, and you know, the current strategy is to deliver more commitment on an aggregated basis to them and ensuring some level of supply through 2021 and maybe even beyond associated with those. So I think that trend is certainly ongoing and here to stay for the foreseeable future. And as far as I'm concerned, if it stays permanently, I'll be okay with that.
I agree. We are also, you know, anywhere we can, trying to go more domestic, diverse suppliers, you know, wherever we can. Because we sell across the entire commercial spectrum. We, you know, we have a lot of healthcare business. We also have a lot of state and local government business, federal government, commercial accounts, all of that. And so there's absolutely, I'll say, demand that everyone would like to see more products being manufactured in the US. And that's a whole lot easier for our supply chain as well to source and get product across the country if it's already here. So absolutely, I agree with Jim. I hope it's here to stay.
Wonderful, wonderful, good for the economy as well. Going back to kind of our career success theme today, I wanted to talk to each of you a little bit about strategies for managing up, which obviously is an important part of being successful and driving successful career growth. So Susan, if you would kind of give us your insights into what your key strategies are for managing up, how you've worked with and built effective working relationships with the senior executives in your organization, and kind of what the outcome of that has been, how that has helped you build your career success and succeed in your role.
So I would say what I've done and I try to do is engage the executive management and C-level for our largest accounts. You know, bring them into the business so that they understand the industry. They understand our customers and what our customers' needs are, and just get them a lot more familiar with the customer and meeting the customer and getting to know them and what the customer's interests are. That to me brings it out of just being a P&L and what does that look like, to them actually starting to understand what this industry looks like and what the needs and requirements are to do business. And, you know, obviously we want to keep the customer happy and have robust products and websites and, you know, supply chain delivery services and all of that kind of stuff. But that goes for every customer. I think for me, it's having them be engaged and understand. And since I seem to be full of stories today, I'll give you a cute story. I took our CEO to our largest customer, and no one from the C-level had ever been there. So I took him in, and so the CEO said to me, "Hey, what should I wear?" And I said, "Just a jacket." You know, he goes, "So I need a tie?" I go, "No, you don't need a tie. They're business casual." So we go, and it was an early morning meeting because he had to fly out later. So they were going to they set the meeting up for early, and we get there, and they're in suits and ties. And he looks at me and he goes, "Hey," and I go, "Guys, what are you doing?" Sandy asked me what to wear, and I told him, you know, just a jacket. And they go, "Hey, Susan, you didn't let us know what the dress code was." So anyway, that was fun. It was funny. But I do, that to me is important. And, you know, bringing executive leadership to the key customers. So I think that's really important at whatever level you can, because then they're engaged. And then I think, you know, if they create a relationship, I think a lot of people that know me know that I'm vegetarian, all that and all of that. And I went out to dinner one night with Jim, with my boss, and the two of them ordered some things that Susan probably would not order, and they just had the best time. Jim's laughing, and I was, oh my gosh. So anyway, but I think that's important. I think creating those relationships is important. And then also, you know, if I'm not doing the job that they want, or they think they need to go over me, they know who to go to. And I think that's important as well. So that's what I do. I just try and get the senior leadership engaged in the accounts so they understand them and they know who the key relationships are.
Do you want me to
Jim,
comment?
you can
Oh, sure, about managing up.
Yeah.
I've shared with many people that I've been really blessed to work at Mayo Clinic, because I've never been once told how to run the supply chain from the most senior people at Mayo Clinic. You know, I seek their advice, their input, their guidance. So keeping them informed and delivering, I think, is probably the best way to manage up in an organization. And if you don't care who gets credit for something, it's also incredibly beneficial to how you work with senior leadership. So you're not coming across as bragging and, you know, ego and a variety of other activities. So I think it can be an easy task, you know, for people. It also can be a difficult task depending upon the politics of your organization and the values and how your organization really is organized. You know, is it a hierarchical structure? Is it a relatively flat structure where people try to treat each other as equals, as colleagues, and so forth? And it's been beneficial for me in Mayo because we're much more a flatter organization, and we work together as a team. Again, going back to those underlying values of the organization.
Excellent. It's great perspective on both sides. I think different ways to work through senior management and stay connected. And Jim, you were talking earlier in answer to one of the audience questions about measuring what you do and reporting that up as well, which is so critical. So yeah, thank you.
That's a big part of it. I tell people there's an old saying I heard a long time ago, and it's if you don't toot your own horn, somebody else will use it as a spittoon. But there's a right way and a wrong way to toot your own horn.
Yes, yes, without letting someone else use it as a spittoon. I like that. I've never heard that one. That's a good one. That's a good one. We have a question that came in, I just noticed, from the audience, and it's focused on Jim, but I think both of you could answer it. And it's related to what you think are the biggest challenges for supply chain in the next 3 to 5 years. So Jim, I think you could answer that one first, but Susan would love your perspective on what you see as the biggest challenges as well.
Yeah, the perspective on that could change dramatically as we have an election coming up, and the policies and the platforms of parties are very different, and depend upon who's successful coming up on early November, whenever we find out, it could dramatically change the focus of supply chain management and also healthcare in general. So that's always a variable out there that we need to stay attuned to. What I see, obviously, coming out of the pandemic and so forth, and some of the current challenges we're going to be faced with, we now understand the importance of systemness and integration to function as a well-oiled supply chain through things like COVID-19. So I think that type of approach to supply chain management is going to grow. I think that we are going to do things dramatically different the next 3 years, if not sooner, in the world of distribution logistics based on our experiences that we've learned. We're all migrating to the use of digital technology. And I think, I know, at least here at Mayo, we have a very robust digital supply chain strategy and how we want to advance our capabilities, both in the source to settle space and also the operational space. And that's going to be a key component that's going to drive a lot of change over the next several years. Data and analytics, I've already talked about, but increased transparency and visibility through key partnerships with suppliers is going to be a critical need. We've already demonstrated the need for it and realized it firsthand through the pandemic. But that's going to be something we're going to have a major focus on. So those are 3 or 4 or 5 areas I mentioned that I think are going to shape a lot of what happens over the next several years with that one major variable.
I agree. I think we have all of those, and distribution is going to be a big one, and especially with so many more people working from home. So for us to not just delivering to workplaces, but also delivering to the home every day, down all of these employees and all being connected and all being, whether it's into our platform, into, interfacing with Mayo and all the other customers out there across the country. And that's become a big key differentiator. It's like Jim said, you don't know how much somebody needs you until they stop delivering. And then all of a sudden you realize how valuable that service was. So, I mean, right now, whether that's, to a hospital desktop or to an employee's home, that's going to be absolutely critical. And then the online tools, and then managing the inventory and merchandising. It's all part of it. I will share, Mayo again had a wonderful response for us. So during COVID, where there were spike areas, we typically deliver to the desktop in a lot of the hospitals. So end user places an order and our driver shows up the next day and walks it down to the 3rd floor nursing station. So during COVID, they didn't want, a lot of the drivers didn't want to be walking through hospitals. And so Mayo actually asked us if they could educate us, if they could educate our drivers and show them what they were doing to make it a safe environment for them to make deliveries, as well as protect their employees. And so they said, can we talk to them? They knew their drivers' names. They had maps made up. They highlighted the areas in their facilities where they kept COVID patients. They said, we don't want you to go there. Here's where they should deliver if there is anybody that ordered from that area. And it made everyone feel so much better about it. The drivers said they were comfortable doing it. So Mayo ended up getting exactly what they needed back, which was the desktop delivery services, but they really took the lead in communicating that messaging. So it wasn't just our supply chain going, hey, they're saying they're doing all these protocols and making sure everybody's safe. Mayo actually educated the drivers, and that made all the difference in the world. Because, you know, you can't force someone to go in there and do that. But when they, when they educated them, then the drivers are like, hey, I feel really comfortable. They're not going to let me go anywhere where I would be exposed to anything. And so we actually took that, and when we had other customers complain about not receiving desktop, we said, hey, maybe you can help us out. And we shared what Mayo did, and that ended up just being a phenomenal solution. And I think we're going to have more and more and more of that.
And that's a great example, Susan, of collaboration and sort of the partnership that I think really came to the fore during the crisis, and that we all know needs to get even bigger, as you mentioned,
Absolutely.
going forward and become more of a critical part of our business operations.
Absolutely.
Christine, I think we have another question or two from the audience.
We do. Thanks, Nancy. So this question asks, what do you feel is the most important coaching advice an experienced leader should give an up-and-coming supply chain professional to be successful? Jim, do you want to start with that?
I can. I would say maybe a couple of things. First and foremost, and I think I mentioned this earlier, have a career plan. Take charge, set your course, and figure out how you want to get to what you want to be professionally, and start executing on the plan. So developing your own, take responsibility for developing your own career development plan. That'd be my first piece of advice. The other thing that was very important to me in my career development, and I can recall many conversations with the individual, and that's have a mentor. Have somebody that you have great respect for, that you want to bounce ideas off, career advice off, any type of advice off, and rely heavily on that relationship. And I've told many people over the years that my first mentor, even the individual that asked me to be the first supply chain executive at BJC, is that individual. And I still rely on him for advice and feedback today. So mentorship with somebody is critically important.
I agree completely. I agree completely with Jim. The other thing that I would say for being on the flip side, the sales side, is learn the business. Learn your customer's business. You need to know yours. Learn your customer's business, because then you're not a salesperson. Then you become a trusted advisor. And I think that at that point in time, then you're helping your customer figure out what's best. And if you do it with, knowledge and their best interests at heart, I think you get a whole lot farther down the road than if you only go in with your own agenda. And I think that's probably one of the biggest mistakes that I see younger salespeople make, is they don't listen to what the customer wants. They go in with, here's my plan, this is what I have to get done. Set that aside. For me, it's what's important to Jim. That's what I got to figure out how to make happen.
That's excellent advice, Susan. We see so many people that want to close the deal. Yeah, we know you want to close the deal, but we really want somebody to understand our business, the demands that are underway in healthcare, and how they can be a solutions provider with us. That's critically important, and we've learned that in all kinds of ways through the pandemic so far.
Absolutely, and I'll add to that. I've been really pleasantly surprised by how many health systems have been really appreciative of, and I'm sure lots and lots of vendors, and us included, where we've tried very hard to get products and services that customers need. And the health systems have been just great, and acknowledge that they appreciated how hard we were trying to do that and how much we were able to help them. And I think that it added value to the relationship because they saw how hard we were willing to work for them. And you'd like to think that that's always the case, but especially in time of crisis, it really is the case. So I'll just throw that in.
Thank you. Great input, great feedback, great thoughts. As we're coming to a close, we've got just a few minutes left here. Just ask each of you to very quickly share maybe 3 key factors that you would look for in an emerging leader as you look at the people who are coming up in your organization and sort of target the ones that you think really have a strong future and moving into top level leadership positions. What are the 3 key factors that you think you look for in a potential emerging leader? Susan, I'll let you take that one first.
I want someone that knows the industry, has good relationships at the with the key IDNs across the country, and is willing to be a team player. I want somebody that's gonna be a part of my team, not just be a lone wolf out there going out and doing their own thing. So we're all rowing in the same direction.
Yeah, I will try not to be repetitive, but if you've been listening, value alignment is critical. And Susan just alluded to it a little bit, being a team player. But if you're not personally aligned with the values of the organization, you can individually destroy an entire team. And you have to be very cognizant that you're looking for somebody that is in alignment with that. I like the broad knowledge and supply chain education, awareness activities. That's very, very important. And there's another thing that we use, in an organization as big as Mayo Clinic, having executive presence where you can relate to people on any different level of the organization, from the CEO to a world-class surgeon, is critically important in advanced supply chain work today. The last thing I'd say, this is kind of really hard to describe, but we look for people that has fire in their belly, is what we call it. So that means they have an underlying passion for supply chain, what we do, and what we want to get accomplished. And it usually doesn't manifest itself in words in an interview, but after you interview somebody, you can tell whether or not they have that passion and they're excited about the opportunity and they want to do the very best job. And that's another critical thing that we kind of talk about in our interviews.
Wonderful. Well, we're coming to the end of our program, and I just want to thank you both, Jim and Susan, for a great conversation today. I know the audience really appreciated all the insight you've provided, and great thoughts that we can all think about as we look at emerging leaders and look at our own careers. And I certainly heard some things from you that I can reinforce, and I heard things from you that I thought back and thought, boy, I sure wish I'd done that. That was a great approach. So thank you for giving us all these great thoughts and ideas, and for taking the time out of what I know are your busy schedules to be with us today and to help us kind of share some insights for our emerging leaders here at SMI. We do have an evaluation that will be coming up immediately following this program, and we would really appreciate it if our participants would all complete that evaluation and give us some feedback on this program, just so we can make sure that the programs we're delivering continue to be of value to you and relevant to where you are today. Our next SMI University program is a joint program with our leadership series. We're combining the 2 in November because we have a great program from the advisory board. They're going to be talking about the supply chain of the future based on some surveying they've done, some research they've done. They've got some really interesting perspective on where the healthcare supply chain is going and where it should go. And I think we'll all take away some great new ideas from that presentation. So we hope you'll join us on November 10th at 1 o'clock Eastern Time, the advisory board team. And again, I'd like to thank Susan and Jim for a great program today, and thank all of you in the audience for participating. And we look forward to seeing you on an SMI program again soon. Thanks, everyone.
Thanks, Jim.
Thank you,
Thanks,
Susan.
Nancy. See you later.